Hello friends, in this video we are going to talk about galactose metabolism. Before this, if you have not subscribed our channel, please subscribe the channel and support us. Okay, we are going to discuss about galactose metabolism. This galactose metabolism has basically three steps. Okay, the first one is galactokinase reaction. Galactokinase reaction in which ATP is used. The second step is galactose 1-phosphate uridyl transferase enzyme used, and the third is your epimerase reaction. Okay, now starting with the first step. So the first step is galactose is converted into your galactose 1-phosphate. Okay, galactose 1-phosphate by using here ATP, because here galactose 1-phosphate, phosphate group is coming from ATP, and Mg+2 is assisting the enzyme, and the enzyme is your galactokinase. Here enzyme, this step enzyme is your galactokinase, and its cofactor is magnesium. Okay, now this galactose 1-phosphate is converted into your UDP galactose. Okay, and the enzyme working here is your GALT, that is galactose 1-phosphate uridyl transferase. Okay, and this is the rate limiting step. This is the rate limiting step of the galactose metabolism. Clear? Here in this step, galactose 1-phosphate to UDP galactose, UDP is coming from UDP glucose. Okay, this is UDP glucose is providing UDP, and UDP glucose, after providing UDP, it is converted into glucose 1-phosphate. Clear? Glucose 1-phosphate. Now next step, this UDP galactose is in equilibrium with UDP glucose, and the enzyme working here is UDP gal epimerase. UDP gal epimerase, or it also known as uridine diphosphate galactoepimerase. By this reaction, this reaction, galactose is channelized to the metabolism of glucose. Galactose is channelized to the metabolism of glucose. UDP galactose may be used, and since the reaction is freely reversible, even if the dietary supply of galactose is deficient, UDP glucose can be epimerized to UDP galactose. Clear? So this step is very, very important step because of the reason which I have told you. Clear? And so this is all about your galactose metabolism. Now we are going to discuss some more important point about galactose. See here. First, that is this galactose is necessary for your lactose synthesis. So UDP galactose combines with glucose to form your lactose. That why UDP galactose is important. Okay, and here enzyme that is working here is lactose synthase. Okay, and along with lactose synthesis is seen in lactic mammary glands. Okay, you are knowing. Along with it, UDP galactose also involved in synthesis of glycosaminoglycans. Okay, again synthesis of cerebrosides. Along with cerebroside, it is also involved in synthesis of some glycolipids. Okay, so these are the uses of the UDP galactose. Now coming to the clinical part of the galactose, that is Galactosemia. The clinical of the Galactosemia. Okay, this is the deficiency of enzyme, that is GALT, that is your galactose 1-phosphate uridyl transferase enzyme. Clear? This enzyme is deficient in a patient who is suffering from galactosemia. This is inborn error of metabolism. Okay, this is inborn error of metabolism, but its incidence ratio is 1 in about 35,000 births. Clear? And due to the block in this enzyme, galactose 1-phosphate will accumulate in liver, will start accumulating in liver, galactose 1 phosphate. Clear? This will inhibit galactokinase, as well as this deposition will inhibit your enzyme that is known as galactokinase, as well as glycogen phosphorylase. Okay, and this too leads to hypoglycemia. Here, this is the first clinical feature, that is a hypoglycemia. Along with it, in galactosemia, your bilirubin uptake is less. Okay, and bilirubin conjugation also get decreased. So unconjugated bilirubin increase in blood. Bilirubin uptake is less, as well as unconjugated bilirubin amount increases in your blood. Okay, along with it, and due to this, liver will enlarge, jaundice will occur. Okay, these are the features of the galactosemia. Clear? And sometimes cataract can also happen in galactosemia. Amino acid or urea is also feature of galactosemia. Now coming to the diagnosis feature, how you will diagnose. So the diagnostic feature is congenital cataract, presence of galactose in your urine, as well as elevated blood galactose level. Okay, coming to for the treatment of galactosemia. So if galactose is withdrawn from the diet, most of the symptoms recede, but mental retardation, when established, will not improve. Hence early detection is important. For effect, infant lactose free diet should be given. Lactose free diet be given to that patient. Okay, clear? So this is all about your galactose metabolism. Thank you for watching. If you like the video, please subscribe our channel and support.